Imagine being denied access to your own medical records, forced to navigate a complex web of bureaucracy just to get a glimpse of your own health information. This is the harsh reality that many patients in the U.S. have faced for far too long. But here's the shocking truth. It's taken 4 presidential administrations to finally take concrete steps towards holding the healthcare industry accountable for blocking patient access to electronic medical data. The Department of Health and Human Services, HHS, has just announced plans to crack down on healthcare providers and IT companies that restrict patients' access to their own medical records, and the consequences for non-compliance could be severe. But what does this mean for patients, and why has it taken so long to get to this point? To understand the significance of this move, let's take a step back and look at the law that's driving it all. The 21st Century Cures Act. Signed into law by President Obama in 2016, this landmark legislation aimed to improve healthcare outcomes by promoting the sharing of electronic health information. The idea was simple: give patients easy access to their own medical records and enable healthcare providers to share information seamlessly. But, as with many well-intentioned laws, the devil was in the details. While the Cures Act set out civil monetary penalties for health IT developers and exchanges that violated the sharing rules, it left the penalties for healthcare providers undefined. This meant that, in practice, healthcare providers could block access to medical records with little consequence. It wasn't until July 2023 that the HHS finally established disincentives for healthcare providers that failed to comply with the law. So, what's changed now? The HHS has announced that it will take an active enforcement stance against healthcare actors that block patient access to electronic medical data. This means that healthcare providers that restrict access to medical records could face unspecified Medicare and Medicaid disincentives, while health IT firms could be fined up to $1 million per violation. But here's where it gets controversial. Some argue that the penalties are too lenient and that the HHS should be taking a tougher stance on healthcare providers that prioritize profits over patient care. Others argue that the penalties are too harsh and that the HHS is overstepping its authority. And this is the part most people miss: the fact that the HHS' own data suggests that information blocking may not be as widespread a problem as previously thought. According to the HHS, only 1,336 possible claims of information blocking have been filed since an online portal was set up in April 2021. That's less than 1 report per day. But, as the HHS points out, this could be because patients and providers don't believe that reporting incidents will make a difference. If that's the case, then the new penalties could serve as a powerful deterrent, encouraging healthcare providers to prioritize patient access to medical records. The question is, will it be enough? As the healthcare industry continues to evolve, one thing is clear: patients deserve unfettered access to their own medical records. The question is, what's the best way to ensure that happens? Should the HHS be taking a tougher stance on healthcare providers, or are the current penalties sufficient? We want to hear from you. Share your thoughts in the comments below. Do you think the HHS is doing enough to promote patient access to medical records, or is more needed to be done? Let's start a conversation.